Everybody, this is Bonnie Vandermeulen, Training Coordinator for Wisconsin Facets. On behalf of our entire Wisconsin Facets staff, I'd like to thank you for joining us today. Today, the topic of our webinar is the Birth to 3 program. Our presenter for today's program is Lori Whitman. Lori is with the Department of Health Services, the Bureau of Children's Services, and she is a Children and Family Program Specialist with the Wisconsin Birth to 3 program. It is my great pleasure today to introduce to you Lori Whitman. Lori?
Thank you, Bonnie. Good afternoon, everyone. Welcome to this Facets presentation on the Birth to 3 program. As a Children and Family Program Specialist in the Birth to 3 program at the Department of Health Services, I provide technical assistance and support to the county Birth to 3 programs in the state of Wisconsin. I want to thank you all for joining me here today to learn more about the Birth to 3 program. Today's presentation will provide information about the Birth to 3 program in Wisconsin. This presentation will discuss the basics of the program, things like who we are, what we do, where we do it, and the rights that families have as they participate in the Birth to 3 program. Let's start with the Birth to 3 program is funded through a variety of sources, including federal, state, and county funding. With consent from the family, parent, private or public insurance, Medicaid, could be accessed. Families only contribute to the cost of services listed on their own individualized plan for their child and family. It is a sliding fee scale parental cost share system for families with incomes at or more than 300% of the federal poverty level. And we call that process the parental cost share system. The Birth to 3 program is an early intervention special education program. Early intervention can help children catch up developmentally and can help parents get answers to important questions so that you can better meet your child's needs. In Wisconsin, it's a statewide program that serves families with children under the age of 3 with developmental delays or disabilities. It is a special education program that supports a child's development using trained and qualified staff. Here in Wisconsin, we have chosen to be organized by county. So the Department of Health Services receives the grant from the federal government, but then we contract with each county, all 72 in the state of Wisconsin, to run the Birth to 3 program for the residents in their county. The program, therefore, is very unique for each child in our program. The services that a family receives depends on the needs of that child and the parents or caregivers, and is based on the family's priorities and concerns. So what does the Birth to 3 program look like? Who's your team? We want to stress that the family is the center of the team. You are a partner, you are someone who helps to make decisions, you are someone who obviously has input, those kinds of things. We partner with families, and you have a team of what we call professional service providers to support the child's growth and learning. The team includes therapists, special education teachers, a service coordinator, and other professionals who work with you as a family to develop an individualized family service plan, or IFSP, that fits your needs, the goals you have for your child and family, and your outcomes. One of these professional service providers is called the primary coach, who coordinates information and services from the entire team. Having a primary coach lets the family and child develop a relationship with one main person. All of our services are based on the goals and outcomes that have been individualized to your child and family. Decisions about what services to offer are made together as a team, and put your family and your child first. You will partner with a service coordinator who will help you locate and coordinate any needed services and supports. All services are provided and funded based upon our federal requirements. The Birth to 3 program allows you to access services that help you meet your goals and outcomes no matter what the funding source is. The Wisconsin Birth to 3 program brings you, as parents and caregivers, into this process. The team coaches you on what you can do so you can continue to help your child learn during your family's everyday activities and daily routines when providers are not there. The supports and services provided through the Birth to 3 program help the child learn, move, communicate, interact, and relate with others, and learn to eat, dress, and take other actions to meet their needs. Services often occur in the form of play-based or fun activities. Your child's and family's interests and daily activities are used to develop a plan that fits your family. The plan lays out how and when services will occur. Bonnie, are there any questions so far about the Birth to 3 program? And maybe we want to allow a few minutes to add any.
We don't have any questions at this time, Lori.
Okay. Then let's go on and talk about how a child is determined eligible for the Birth to 3 program. Eligibility is based on one of the following criteria. Either a developmental delay of 25% or more in one or more areas of development. And by that I mean areas of development include learning or cognition, moving, seeing, and hearing, what we call physical development, communicating and understanding others' communications, speech and language development, responding to and relating to others, and that's your social and emotional development. And the last area, eat, dress, and care for daily living needs, or what we call adaptive development. So there's the 5 areas: cognition, physical, communication, social and emotional, and adaptive. Okay, so we utilize testing tools that have been developed related to thousands of children they've been used on in order to determine, when we're evaluating a child, whether or not that child is showing a delay of 25% or more compared to all other kids their age. Okay. In addition to a tool, though, we also use a variety of other information. We will observe the child in one or more settings. So we might come to your home and observe how they interact and function in the home setting. We might go to the child care, if they go to child care already, and see how they're interacting with the teacher and the other children there, etc. In addition, we do interview and conversations with you as parents or other caregivers to learn what you've observed your child able to do and what they're struggling with, in order to get a really good picture of what your child's doing. We also request to look at medical records, because there could be either something in the medical history or a diagnosis that has been made that can help with eligibility. That's all under developmental delay. We use all those tools to determine if the child is showing a delay or not in one or more of those 5 areas that I outlined. The second way a child can be found eligible for our program is a diagnosed condition with a high probability of a developmental delay, either showing now or in the future. There has been lots of research on different developmental diagnosed conditions, that we know that based on the history of that condition, the child will show a delay or disability. Let me give you a couple of examples of what would be some diagnosed conditions that would be found eligible for our program. due to the high probability of the child exhibiting a developmental delay. Some of the more common ones that we think of include children who have Down syndrome, children who are diagnosed with autism or on the autism spectrum disorder, children that have charge syndrome, fetal alcohol syndrome, Fragile X if it happens to be a boy or a male child. So those are some diagnosed conditions that research shows that this child would benefit from intervention because they're most likely going to be showing a developmental delay at some point. And so even if the child is not showing any delays at this point, when they're referred to the Birth to 3 program, with that diagnosis that was come from a physician, not the Birth to 3 program, obviously, it's a medical diagnosis, we can find the child eligible and we can support the family in not only understanding what that diagnosis means, but what it could mean for their child's development and how to not prevent it necessarily, but intervene to limit or reduce the impact of it by what we provide and how we support you in providing opportunities and practice, etc., for your child. The third way that a child can be found eligible for the Birth to 3 program is what we call atypical development. And this means that the child did not show a 25% delay, but maybe close to that. Let's say 15 or 20% delay in one of the developmental areas. And there's something about their development that is atypical to what we would expect. And the team, which of course includes the family, determines that that atypical development is negatively affecting the child's overall development. And so we're saying we want to intervene early because if we do any sort of waiting, it will end up showing at least a 25% delay in the near future. So let's intervene now, and that way we can again intervene early, which is always our practice. The sooner you jump on something, the bigger impact that you have. Are there any questions, Bonnie, about eligibility?
Not at this time.
Okay. So I am a rules person, and I believe it's important for everyone when they learn about a program to know what's kind of behind it. And so I wanted to walk through a few of the rules and regulations that guide the Birth to 3 program. We have both federal and state laws and policies that guide our program, and every state in the United States has a Birth to 3 program. They don't all call it Birth to 3. Some call it Part C, some call it early intervention. So there's various names in each state, but it's provided across the country. At the national level, the Birth to 3 program, as I shared earlier, is a special education service. So it's administered by the Federal Department of Education. And they developed a law many years ago called the Individuals with Disabilities Education Act, or IDEA. And that act at the federal level mandates that each state have a Part C program. It is also the special education program through the school district, or Part B. So it covers both programs pretty much from birth until the child graduates from high school or leaves high school. So that's our federal law, and it obviously has requirements for what the Birth to 3 program needs to provide and how, and timelines with that. We also have at the federal level what we call the Part C regulations, and the CFR stands for Code of Federal Regulations. So we have that big law, IDEA, and then kind of as a sub-law, I'm putting quotes because that's a word I made up, you guys. We have what are called the Part C regulations, which give more detail to what the Birth to 3 program in this case, because we're Part C, has to do. There's also regulations for the school system for Part B. So if you ever want to look up the Part C regulations, and I always encourage it, You might think, oh, the law, but it's actually not that hard of a read. The IDEA is, I wouldn't read that one, but the Part C regulations are very easy to read. You would Google 34 CFR 303 and you would get a copy of them. They just outline again more details about what each state birth to 3 program must do, what we have options to do. It talks about our grant with the federal government and what we have to do to keep that grant. And then more particularly to this conversation is, what do we need to be offering to the children and families that we serve? Last but not least, in Wisconsin, we have State Administrative Code DHS 90, stands for Department of Health Services, where I work, number 90, and this provides additional specific requirements for how the birth to 3 program in Wisconsin is run, and any additional requirements from what the federal laws have required us to do. In the birth to 3 program, when we were started over 30 years ago here in Wisconsin, we have what's called an Interagency Coordinating Council, or ICC. It's a governor-appointed advisory board, and they guide the department in things to think about regarding the birth to 3 program to obviously improve it. Well, way back over 30 years ago when we started the birth to 3 program, they helped us to develop what we call guiding principles. These are those beliefs about children, about families, about our program that help guide the work that we do, both at the state level and at the county program level. So here are our guiding principles. Children learn best from their families, people that they know, people that they're familiar with, and within the context of things that they're going to be doing every day, their everyday activities and routines. Just all children learn best through that. The Birth to 3 program, therefore, provides services in natural environments and during everyday activities. So by natural environments, we're saying what's natural for your child and your family. If your child does not go to childcare, then that is not a natural environment for your child. If instead they are cared for by you or by grandma or the neighbor, then that is the setting that we would start offering some services in if your child's eligible. And then we look at their everyday routines of snack time, meal time, play time, sleeping, bathing, those kinds of things, because those are the opportunities throughout the day that every child's going to go through on a routine basis, right? Every day you do some of those same things over and over and over again, that in order to practice and learn and develop new skills. In addition, we look at the child's interests as a basis for their involvement in any activity, because children become more engaged if it's something they're interested in, right? Then they want to play with you. Then they want to participate. If you have a child who loves trucks and you introduce dolls, they might not be as interested. Now they might, because you might be introducing a new interest to that child, but we want to at least start with what they're currently interested in order to engage them and get them comfortable and started in the activity, and then we can add new skills for them to practice and try. When children are engaged in an activity and not just sitting and watching, especially at this age, I know older kids go to school and they sit, that's what we do, but young kids under 3, they need to be engaged, they need to be doers, right? Then they're going to practice their existing skills more, and they're going to learn new skills more if they're engaged in those activities. In addition, our second guiding principle is that we believe that all families can enhance their child's development and their child's learning. Families have the greatest impact because you spend the most time with your children. Even if they go to childcare, you are still the people spending the most time with your children. And so you have the most opportunity. And children also look to their families, their parents, their caregivers, their siblings for interaction, for help and assistance, those kinds of things. So our IFSP, that's that plan that I mentioned that we would develop with the child and family, those outcomes must relate to what's important to the family and to the child. What do you need to help your day go better? Not what do I think your child needs because a tool or a test told me they can't do this. I'm going to give a very simple example. And of course, there's always more information that you need, but this is a very simple example. I worked with a family once that the tool said, this child isn't using steps and they can't do it alone, and they should be able to by now because they're 2. And so you need to work on increasing the child's ability to use stairs. So I had a conversation with the family. They don't have any stairs in their house. They live in an apartment. They use the elevator, right? And within their apartment, they have no stairs because everything's on the same floor. So where is this child supposed to be practicing stair skills? So we said, you know what? You're right. Right now, your child doesn't need that. There is nothing that you can always work on other skills. And ultimately, the child will learn the skill that the tool or the test is saying they have to learn. So perhaps looking at using a step stool in the kitchen to help mom with cooking, or a step stool to help dad set the table, is still sort of a step, right? And indirectly, that will help the child learn to do stairs for when they do go to places where there's stairs. And so that's just a very simple example of how we need to make sure the family's at the center of the team and really the decision maker of what needs you have, what needs you feel your child has and needs to get worked on. We see the primary role of our staff, our service providers, is to build the caregiver's capacity to support your child over their entire life. We are the Birth to 3 program, which means as soon as a child turns 3, our program ends for that child and family. So we're not going to be with you for very long, even if you are eligible for our program. That family is going to be there forever, right? So what we really want to do is support family members and other caregivers like grandmas and childcare, etc., in understanding what's going on for this child, how to support that child, and give that little bit of help so that they can continue to grow and develop even once they're past our program. Another guiding principle is that each family has different strengths and needs. So guess what? Our goals and services must be individualized. Not every child's going to have the same goal in our program. Not every child's going to get the same services or the same amount of services. And it can vary for one child while they're in with us, because they might really zoom up on skills and now they need some other type of support. So we're going to change what we offer or change how much we offer. And last but not least, we are required by federal law that the services and the strategies that we use are based upon research that has demonstrated the effectiveness in impacting a child's development. We all hear about medications or drugs that are supposed to cure this or do that, and we find out later, they don't really do that, right? The same is true for strategies. There's those that have been researched, that have been utilized for many, many years and have been proven to help a child learn to talk or help a child learn to better interact with toys and people in their environment. And there's those that haven't proven that. And so in the Birth to 3 program, we do a lot of work around assuring that we're using those that do make a difference, so that not only will you hopefully see it while you're in our program, but you'll also see it continue throughout the child's life. That was a lot of information. Are there any questions, Bonnie?
Actually, we do have one that just came up.
Okay.
When since you develop an IFSP, when is there coordination with the next step when a child transfers to the school district, and whose responsibility is it to follow through with that? And will you be covering that later?
That's a great question. And honestly, that's one of my areas of expertise here at the department, and I cannot believe I didn't have any talking points about that. So I'm going to answer that question right now. We are required by law to, for sure, have a conversation with a family who's currently in our program when a child is close to turning 3, which in Wisconsin we define as 2 years, 3 months of age or older. And at that point, start talking about leaving our program, because your child either has still been with us for a while and has now turned 2 years, 3 months of age, or came in after that particular age and only has until age 3 to be with us. And we do not want that to be a pit that families fall into and go, oh, now what do I do? So your service coordinator, who some people call them a case manager, but your service coordinator's role is to touch base with families sometime after the age of 2 years, 3 months, and start talking about what are your options for after age 3. Or if you happen to leave before age 3, whether it's because you're moving or your child's doing really well, or you want to pursue some other kind of service to help with how are you going to, and your child, gradually leave our program and move into that next program. It is actually part of our IFSP, that Individualized Family Service Plan document. And for those of you familiar with the IEP, it's kind of the counterpart, but they're very different in what they need to include. But we both need to have a transition plan that outlines what your goal is for your child and family, in this example, when we leave the birth through program, and who's going to do what steps are going to be taken, who's going to do them to move us into that next step. For children that are still showing considerable developmental delays close to age 3, the team, which includes the parents, will have a conversation about, do we think this child is potentially eligible for LEA services? LEA being your school or local education agency. If the answer during that conversation is yes, we think your child would be potentially eligible, then the Birth to 3 program offers and conducts several activities to connect you up with the school system and get them started on their process, so that as soon as your child turns 3, services can begin if your child's found eligible for the school system's special education program. Okay. I can go into, because I think I have the time, I can go into, there's 3 specific activities that we do with the school system if we determine a child is potentially eligible for their services. One of them is that we offer to the family what's called a Transition Planning Conference, or TPC, Transition Planning Conference. And that's a meeting between the family, the Birth to 3 program, and the school system to kind of do a warm handoff. Have all the parties ask questions, share information in order to say, why are we thinking that this child might be potentially eligible for the school, and for the school to say, here's what we're going to do with this information. Here's what our evaluation process is going to look like, etc. From that point on, then, the school system will contact families and schedule evaluations and determine eligibility, etc. The second activity that we do is make an actual referral to the school district, which we do in writing on behalf of the child and family, in order to, in writing, tell the school, yes, a referral is being made on this child, and please offer an evaluation to this family. The third activity is that with your written consent, we will share some or all of the records that we have compiled, the evaluation reports, a copy of our IFSP, maybe progress notes, things like that, with the school, to give them some background information to begin their exploration of what areas should we be evaluating, what might we be looking for in regards to eligibility, and what additional information do we want to get consent from the family in order to conduct, to officially and adequately determine if the child's eligible for the Birth to 3 program. If your child is determined not potentially eligible for the school system, we still offer transition support through a discussion and an outline of all the other kinds of services in your community that could be available to your child and family based upon the goal that you have. So for example, we've had families that have said, my child's really gained in their skills, they're doing well, we don't think they're going to be eligible for the school, but I want my child to get more experience with other kids to assure that they're using those skills with their peers. So, we might talk about play groups or library time or childcare or other types of activities that are available in your community that you could access. Head Start is another example for certain families. So we still have the conversation and we support families, and we do that for all kinds of transitions, even while you're still in our program. Let me give you a real easy example. Your family moves from one county to another. Because we're county run, we contract with each county, you're ending your services in one county and you'd be transferring or moving your services to another county. And so we'd want to assure that that process is fast, smooth, effective for you and your child, right? Because you're going to have new staff that you're going to be working with. There's going to be new paperwork for you to sign, all those kinds of things. So the sooner we know about those kinds of transitions, then we can develop a plan with you about who's going to do what. Are we going to give you the whole record and you're going to give it to the new staff, or do you want us to mail it to them? Those kinds of things. Are there any other questions, Bonnie, either about transition or anything else?
No other questions at this time.
Okay, then I'll move forward. One of the important pieces, the federal legislation has been updated, I'm going to say 2 or 3 times. I don't know the exact number. Bonnie, you might actually know that, at the federal level. And one of the things that it has stressed for special education in general has been the importance of parental rights, being informed about what is being recommended and going to happen with your child, and what's going to happen about all the records that we keep and those kinds of things. So I like to share with families what your rights are and talk a little bit about them. Programs are required in the Birth to 3 program and the schools, but Birth to 3 programs are required to follow specific steps in order to determine a child eligible and then provide services and then support transition as they leave. And we are required to respect your views and preferences about what you think your child needs, what would help and benefit your family in order to support your child in the developing new skills or meeting those needs, and that kind of thing. So here are the five of what we call basic rights that you have as a parent. There's a records right. Parents need to be informed about what records are gathered, what kinds of information are we going to be asking you and keeping, right? Whether it's in paper or it's electronically. What are we gathering about your child and family? Where do we keep these records? How do we assure they're kept confidential? Are we putting them in locked drawers? Are they electronic and you have to have a password? All of that kind of information. How long are we going to keep these records? And when will they be destroyed? Okay, so you are informed of also who has access to these records about my particular child, whether I've signed a release or I haven't signed a release for that person to have access. So I'm going to give just a couple of examples here. Your IFSP team, the members of your team that have been put together to support you and your family, are people who are considered to have access without the need of a release, because you've already consented to participate in our Birth to 3 program and you've consented to the services that we're offering. So they can review the records, they can add to them, they can look at them over, those kinds of things at any point. People outside of the Birth to 3 program, though, the school, as an example, your doctor, childcare providers, Head Start, your neighbor, a stranger on the street. We cannot share anything about your child's records, including if they were eligible or not, unless you've signed written consent for us to do that. And that's what we call a release of information. And so we do gather quite a few releases in the Birth to 3 program, depending on where your child's seen, what we've talked about how we want that person involved, what they need to know. But we might share, for example, the evaluation reports with your physician or doctor. Whereas with the school, we'd probably share the IFSP, again, if you give consent. Related to records then is the confidentiality piece. What's important to note is many of you have heard of HIPAA. And I'm blanking on what it stands for, but it's the, health something, but it's for medical records that medical people cannot share, right? Your medical records with anybody, again, except for under certain circumstances without a release, but mostly with the release. So the Birth to 3 program, being an educational program, is actually under the FERPA law, stands for Family, Education, Rights, and Privacy Act. FERPA, F-E-R-P-A. And this act requires that only certain individuals have access to records without assigned consent via a release from the parents. It also indicates that you as the parent have the right to see, look at the file anytime you want, and receive a copy of your child's file. And the first copy is free of charge, okay? So there's laws, for example, if a parent says, I'd like to see my child's file today, well, we have up to 10 days to get you access to that because it could be in multiple places based on contracts and things like that. But we would certainly be very prompt in getting you access to that. And each release that we have you sign should indicate exactly which records we're planning on, or requesting, I should say, to share with whoever's on that release, whether it's the doctor or the school or the neighbor. Okay? So that's confidentiality. And we're very strict about that because we know that people are at different levels of what they want to keep private about their child and family, and we want to respect that. And of course, because the law says we need to. All right, prior written notice, or PWN. Prior written notice is a process of providing information to the family about a decision that we want to make in order to assure that when you consent or don't consent, you're making an informed decision. So there's about, I believe it's 6 or 7 situations in the Birth to 3 program when we are required to provide prior written notice. I'll give you an example. If we would like to evaluate your child to determine if they're eligible for the program, we have to provide prior written notice to you about what we want to do. In this case, evaluate your child. Why? To determine eligibility. How are we going to do that? Here's the 1 or 2 or 3 tools or tests that we're going to implement. Or, for example, observation might be in there, or parent interview, those kinds of things. What are we actually looking for in order to make that answer, right? Do they show a 25% delay? Do they have a diagnosed condition? Those kinds of things. And then we always give a copy of all your rights, which is a 6 or 7 page document to outline in more detail these rights that I'm explaining to you today. So prior written notice happens anytime we're making what we're considering a major decision. Things like, are we going to evaluate? What services are we offering? When is the last day your child's going to be in our program? Those kinds of things, in order for you to really understand what, why, how, so you can make an informed decision about whether or not you want to consent or not to give consent for that activity. Which leads me right into the consent part, which for the Wisconsin Birth to 3 program is written consent. There's other types of programs where you can just go verbally, yeah, over the phone, whatever. We cannot accept that. We need it in writing according to federal law. And that constitutes then a written agreement between you as the parent or caregiver and our family, or pardon me, and our program regarding that you're saying yes to us conducting that activity, such as doing an evaluation, providing services, changing services, those kinds of things. And last but not least, you have the right to resolve any conflicts or disagreements related to all the activities that the Birth to 3 program conducts. And we call those dispute resolution options. There are what we call the informal dispute resolution options, things like talk to the person you're having an issue with. You call me, say, Lori, I'm not very happy with how that last home visit went. Can we talk about this? To possibly contacting my supervisor or the program coordinator of the Birth to 3 program and kind of going through steps that way. You can also, if you're questioning or have more information or want to rediscuss one of the decisions that you were given prior written notice about, before you sign the consent, you can request another meeting called the IFSP meeting, where the team would get together and you'd rediscuss and maybe add in new information that you've learned in order to help decide which way should we go, what should we move or plan for your child and family moving forward. If none of those work, or instead of those, you have the right to one or more of 3 what we call formal dispute resolution options, including mediation, a due process hearing, or an IDEA. That goes back to our federal law, IDEA complaint. Mediation, you may have heard of. It is when a third party comes in and helps the 2 parties, in this case, the parent or legal guardian and the Birth to 3 program, to have a good conversation and resolve it on their own. The mediator makes no decisions. A due process hearing is different. That is where an administrative law judge would come in, hear the parent or legal guardian side, hear the Birth to 3 program side, and make an official decision that is law. And then whichever way it falls, that's what ends up having to happen. An IDEA complaint would be made if you or anyone in the world can make a complaint about the Birth to 3 program. The laws in IDEA, the Part C regulations, or DHS 90 for Wisconsin is not being followed, is being broken by either a county Birth to 3 program or by the state overall. And you would write actually to the department, and it's not me, we have a different section in our bureau that does the investigation, might be interviewing people, reviewing records, and make a decision about whether or not that law has actually been broken. And if it has, put into place next steps for fixing that. If you would like more information, please see the brochure from our website that's listed here, Your Child and Family's Birth to 3 Program Rights. It gives you more details on all of these rights. Lastly, I have a few resources here, and I'm hoping, Bonnie, I don't know, in their handout if these links are actually clickable so that they can go to them. But if you Google the Birth to 3 program and anything about first 1,000 days, you could get to this site. We have an outreach webpage. We have spent over a year, I believe, working on different materials to help educate the entire community on the Birth to 3 program. So there have been resources developed for families to help you better understand the Birth to 3 program, what it is, what it isn't, how to get connected, those kinds of things, for our referral sources, because anyone can make a referral to the Birth to 3 program. Our most common referrals are from doctors and parents, but we get them from any agency or program that works with young children. So Head Starts in schools, child cares, alcohol and other drug abuse programs will sometimes make referrals. Homeless shelters might make referrals. Neighbors and grandparents sometimes make referrals. So anyone who has concern about a child can make a referral to the Birth to 3 program. And the first step for us then is to contact the parent or legal guardian, explain our program and say, are you interested in looking further into your child's development to see if there's any needs that we can help you to address, okay? So that first link for the Child Find campaign has a variety of different resources for referral sources, for parents, for doctors specifically to help explain the program. There's also a more general Birth to 3 program brochure, which is the second resource listed here, that can help you with understanding more about what the Birth to 3 program is. And then the last link on this slide is to the contact page for each county Birth to 3 program. So you would click on that and you could enter your county. So you live in Barron County. You click on do search, and you now get a listing of, if you want to make a referral, who is the primary point of referral that you need to contact to make that referral, or the primary, program coordinator and the administrator for the Birth to 3 program in that particular county are also listed. And you can contact them at any time to learn more about what is that county's Birth to 3 program looking like, how, what questions you have, they can answer them for you. You can, of course, always call the State Department also, and I believe we're also listed on that page. That concludes my presentation. Are there any more questions, Bonnie?
There is one question, and it says, if you live in a rural area of the state, sometimes some of the doctors who are just family practitioners don't always have the information that they would need for referral purposes. How would you suggest families educate some of those individuals?
That's a great question. And with our new Child Find campaign information, we worked very hard with county Birth to 3 programs, actually. So the state sent materials out to what I would consider major medical providers, children's hospitals, Marshfield clinics, those kinds of things. But we also asked county Birth to 3 programs to also distribute materials and share that information. There, on that Child Find campaign website, there are not only brochures or handouts, but there are like emails or things you can put on Facebook that might catch someone's attention to tell them more. So feel free, you can either order from the department to get it kind of all fancy, or you can print off what's on there and share it with the doctors that you're aware of, that you feel might not know. What I will tell you is most of our referrals, although the doctor might be recommending it, the nurses, or sometimes even the clerical staff are the ones who actually make the calls and let us know that they'd like to refer a child due to something the doctor saw. So doctors need to know an awful lot, and they don't always maybe know all the details, but someone on their staff hopefully does. But if they don't, we would appreciate your assistance in getting the word out. We are continuing our campaign and looking at what, if any, new additional materials need to be developed, but there will be some sort of annual schedule of continuing to reach out, because we also know providers change at clinics all the time. So we want to make sure anyone new to the clinic is made aware.
Okay, we have one other question for you.
Okay.
Can you explain when it is possible that a family would have to cost share, and how the B3P works with insurance companies? For instance, would a family have their insurance company pay for the Birth to 3 cost share as well as additional outside therapy?
Okay. So, and it's, I like being in person for this because it's better for visual. So I'm going to try to use my fingers. So we have a process of funding sources that we use when family's eligible for a program. The parental cost share is like the third or fourth funding source that we utilize, okay, typically. The parental cost share is a sliding fee scale. And as I shared earlier, you have to be at, I always have to read this, you have to be at or more than 300% of federal poverty level before you even have a parental cost share amount. The maximum any parent, no matter how many services they get or how long they're in the program, the maximum annual parental cost share, so it covers a year's worth of services, the maximum any parent pays is $1,800, $1,800. I will tell you that the average IFSP costs the program around $10,000. Okay, so you're paying a portion of that. Because parents either have to give us consent to access private insurance or Medicaid public insurance. Let's pretend you've said yes to letting us access those, okay? Those would be our first two funding sources. We're going to start with private insurance, and we'll bill them, and if they pay, great. If they don't, we bill Medicaid, okay? Assuming you have Medicaid. If those two funding sources do not cover the total cost for our services, then this parental cost share system kicks in, okay? Let me give you an example of some of the costs. So I know that therapies are often billed. They're the only service that we provide currently that can be billed to private insurance and Medicaid, okay? So you're getting a therapy service, and private insurance covers the 45 minutes that the therapist was in your house. But the program has additional costs related to providing that service to you, because most likely they had to pay for that person to get to your house, whether they paid for their time to drive to your house or they paid for their mileage or both. So that's an additional cost to the services to your child. That drive time and or mileage is not billable to private insurance or Medicaid. Now, it's also not going to cost as much as the therapy session in and of itself, right? But let's say it costs $10 to come to your house every month for however many visits we have scheduled, okay? That's $10 that's not paid for by private insurance or Medicaid. And so your parental cost share, whatever amount you have for your whole year, is going to help us cover that cost. And there's additional costs. For example, because we have a primary person who supports your family, but one person can't and shouldn't be expected to know everything. They have a full team of people that they meet with on a regular basis. And at least quarterly, they're going to be talking and conversing about your child and saying, is there anything I'm missing? What other ideas should we be providing to this family? What else should I be asking them about what's working and what's not working? And so that time getting together as a team to support, consult, help each other to make sure that you're getting the best services for your child and family are also not billable to private insurance or Medicaid. But it's costing the program because staff don't want to just sit there for free, right? I still have to pay them. So your parental cost share helps to cover those costs. Now, how does that, so the parental cost share is not private insurance. You cannot bill it to your private insurance. You cannot bill it to MA. It is a whole separate funding source. And for those of you who have things like HSAs, health savings accounts, or there's another word that's a similar type of an account, if you have one of those and you join the Birth to 3 program, please make your service coordinator aware, because some of them will help you pay for your parental cost share amount and some won't. And so having conversation with your service coordinator to help you determine with your employer, will they or won't they, will help ease some stress for you. But we do not bill your parental cost share to anybody but you as a parent. I hope that answers the question.
Okay, thank you, Lori. Would you happen to have any contact information that you can tell people if they have further questions after we finish our discussion today?
Sure. So first I'll direct you to the last link on this resource page, because it, like I said, it can either direct you directly to your county Birth to 3 program who can answer questions, or I believe on the right hand side it says state contacts, and I'm listed there too. But let me also give you, I can give you both my email and phone number if that would be helpful. So I'll have to spell things out because I can't type anything while I'm showing the screen. So my email address is L as in Lori, O as in octopus, R as in ride, I as in ice cream, dot, W for Wisconsin, I as in ice cream, T as in Tom, T as in Tom, E as in egg, M as in Mary, A as in apple, N as in Nancy, N as in Nancy. So Lori.Widman, then the @ sign, WI.gov for gov, short for government. So that's Lori.Widman@wi.gov. Or my phone number, which you can certainly call, but most likely I will tell you you'll probably be leaving a message and I'll have to return your call, which I will do, but I'm usually in meetings during the day. So, but my phone number is 608-225-5891. Now, on that state, that county contacts link below, at that bottom one, like I said, on the right-hand side, it'll have state contacts, and I have 3 colleagues. I typically cover the western side of the state, and I have someone who does the northern northeast, a colleague that serves the southeast, and a colleague that serves the southern. Any of us can answer your question. So please don't feel you have to contact me, but again, I will do my very best to get back to you within 24 hours, whether you email me or call me.
Well, thank you very much, Lori. We greatly appreciate it. So we, at this time, we're concluding our webinar. If anyone else has any other questions, Lori just provided you with her contact information, and so please feel free to do that. Again, thank you, Lori, for a great presentation today. We appreciate your expertise, and thank you, everybody, for joining us at this time. Please be reminded that Wisconsin Facets has over 100 scheduled trainings and webinars for the year 2022, and please check out our website calendar and register for any of the upcoming trainings that may be of interest to you. Also, please wait for the short evaluation coming your way after today's live presentation. Thank you again, Lori, and everybody have a good day. Bye-bye, all.